Thank you so much for joining me on the Slice of Healthcare podcast. How are you today?
Hi, Jared. How are you?
Doing well. I'm excited to chat. I'm just going to let the audience know, I told you this a few moments ago. This is my first podcast I'm recording without coffee. Now, as Rachel just told me, she doesn't drink coffee, so that's not an issue for her. For me, it could be, but I'm going to power through it today because I have this natural energy. I'm really excited to chat with you. So I'd love if we could just dive right into it. Could you tell the audience a little bit about your background, and then we'll talk about your new role?
Sure. And if this is you without coffee, I'm excited to see you with coffee because you definitely have a lot of excited energy, and I'm happy to be here today. To give you a little bit of background, I am the new VP of Innovation at Tampa General Hospital right here in Tampa Bay. I guess a little bit of background, I came to TGH in January by way of the Florida-Israel Business Accelerator. I headed up that organization for just over 3 years. And before that, I spent my career as a practicing business attorney. So doing all things investment, intellectual property, and M&A, from everything from venture to M&A. So really familiar with kind of this space of working with startups and the companies that are their customers and the investors that invest in them. So started to get familiar with the ecosystem from the perspective of an attorney before kind of jumping fully into the startup and innovation ecosystem with FIBA. So that's a little bit about my background.
What was one of the things that, or you can give us multiple things, that you wanted to accept this role, this new role at Tampa General? It sounds super interesting. It sounds like a role that you'll continue to obviously grow into and kind of get the shape, which is, I think, the best type of role you could ever ask for. But what were some of the things that kind of made you want to join this organization and start this new role?
Sure. Yeah. I mean, I think there's a couple of things. First off was just Tampa General Hospital. It's always exciting to join an organization that you feel like is really on the rise. And that is a sense that I got from, even just working with TGH during my time at FIBA. I worked closely with some of the leaders, including our CEO and CIO during the time that I was at FIBA. And then also, even just as someone who lives in Tampa, it was clear to me that big things are happening over at Tampa General. We are the region's only academic health center. It's an incredibly, even without someone with the title of innovation, it's already a very innovative place. And I got to see that firsthand with the work I was doing at FIBA. So being part of an organization that really, you get the sense, is growing and is doing big, meaningful things in healthcare and for our community was exciting for me. And the opportunity to work with the people here. I mean, the organization wouldn't be doing the things that it's doing if it wasn't for the people doing all the work. So an incredible CEO in John Corris, our Chief Information Officer, Scott Arnold, who actually traveled to Israel with me as part of a trip that we did of Tampa leaders to Israel back in 2018. Or 2019, I should say, 2019. The world got a little crazy in 2020. But getting to work with those folks was really, really important to me. And then also, I got to do this a little bit at FIBA. Build something kind of from the ground up is something that I really enjoy doing. And I saw the opportunity to do that with InnoVentures. We wanted a platform and really a vehicle to drive the innovation that's been happening at TGH, and to do that in a more formalized and structured way with a team that's going to wake up every day thinking about innovation and how it's going to impact the hospital and the future of healthcare overall. So the idea to build something like that was really exciting to me.
Now, can you share with us, again, it's obviously still early in the process, but some of the things that you'll be, I guess, looking into within healthcare, and then also, I'm assuming there's more of a focus on internal innovation that allows Tampa General to really continue to innovate. But would you also be looking at local startups and organizations that you can partner with for innovation as well?
Yeah, interestingly enough, we're actually kind of starting full on in that outside in innovation space where we see a lot of opportunity to solve very real and critical challenges within Tampa General Hospital. So everything from operational efficiency to driving quality and safety, which is of the utmost importance. There's a lot of great startups and companies that are already out there doing this great work. So at our core, InnoVentures is going to focus on both that outside in innovation, working with those startups, both where we think we have opportunities to co-develop, using the amazing resources and talent that exists within the hospital to co-develop with these folks, and places where, maybe there's a win-win where we're an early adopting customer for that startup, and there might even be an investment opportunity, because that's another thing that InnoVentures is doing. We also house the corporate venture arm for Tampa General. So we plan on making direct investments into a number of these exciting startups that are solving challenges and creating opportunities within the hospital. So where it's almost like a win-win, right? Where we know that TGH can benefit from this, this new solution or technology. We can invest in that company to help grow it and help others solve the same problems. Then we're part of the solution of helping to solve those big challenges within healthcare. And some of those areas where we're starting out and looking at right now are things around, I think I mentioned, operational efficiencies. We know that there's just a ton of opportunity for us to just do a better job by the patient, right? Healthcare can be complex, it's costly, it's confusing. And I think that's really where innovation can come in, is to try to question why have we always been doing something this way? Why can't we do it another way? And lean on some of those exciting startups that have already maybe figured out some ways that we can do things better. And then everything, and also like maybe horizontal solutions, like we're really looking at how AI can improve and drive safety, patient safety, and quality outcomes. The technology is finally in a place, I think, where it's not hypothetical, it's real, and we can use it, and it'll also help us deal with things like nurse shortages. I mean, there's challenges that people face in terms of finding nurses who, especially coming out of a pandemic, who can care for patients. And if we have a lot of those really highly skilled, sought after folks who are spending their time behind computers, producing reports and abstracting data, when we know that machine learning can do that for us now, well, why don't we do it? Why don't we do it now? So those are some of the things we're focused on.
I love that. Yeah, it's funny when you mentioned AI too. We had a conversation. I had a conversation the other day with, I was telling you, the founder of MeMD, which just got acquired by Walmart Health, right? He came on and we had a big discussion on just how much AI can actually do for us within healthcare that 5, 6, 10 plus years ago it couldn't. Which it's also creating opportunities for different healthcare professionals to adapt how they work. I don't see it as I think see it as a negative too, right? Because it's like, oh, is my job going to go away? No, you're going to be able to focus more on what you should be focusing on and not on the reporting and the analyzing charts piece maybe. So I'm excited.
You're exactly right. Yeah, I think that's really important, and something that a few years ago people didn't really recognize. Everyone thought, okay, the robots are coming for our jobs, but I think you're exactly right. If as a doctor, I know how so many people, we go to the doctor now, and you wonder, like, they're not even looking at me, right? How do they're just on the laptop inputting all the data and doing a lot of searching for information they need. I think there's a lot of ways we can use AI, not just for reporting outcomes, but also for helping provide care paths and helping. It's not to tell a surgeon, okay, this is what you should do exactly and how you should do it. It's really going to give back a lot of time to these physicians who, to provide care, to connect with patients, to do the aspects of their job that we want them doing, as opposed to, having their heads in the screens while they're trying to, meet with a patient, just as an example. But you mentioned the Walmart. The other big area where I think we're going to focus is trying to bring healthcare to the age of consumerism, right? To the Amazon age. We don't need Amazon to do it all. There's places where health systems and hospitals are better equipped to provide care. We just need to meet the customer, the patient, as a consumer, in the way that they've grown accustomed to, to being met, in the age of convenience and communication and direct marketing and all of those things.
Absolutely. So just to let the audience know too, this is our first episode together. The goal is to put together additional content, and you're still obviously in the first few months of the role. This conversation will continue to dive into different areas that you maybe changed focus into looking into, or maybe some investments that you recently made, or some companies you partnered with, right? So there's a lot of ways we can go with this. So I just want to thank you so much for being a guest on the podcast and sharing some of this information. And I'm really excited to continue the conversation on future episodes with you.
Thanks, Jared. I look forward to it.
Thanks.